intrauterine growth restriction. First is high risk pregnancies. Intrauterine growth retardation due to preeclampsia. So now we will call it restriction. Red blood cells isomerization, maternal diabetes mellitus, preterm pre-labor amnioresis, maternal autoimmune disease, twin pregnancies. These are all high risk, and as we can see, the first in the list is IUGR. Preeclampsia and IUGR associated with an inadequate quality and quantity of the maternal vascular response to placentation. So when the placenta is in demand of vascularity, the proper quantity of blood and the required quality of blood is not being supplied by the maternal vascular system, which can result in inadequacy and then ending up in preeclampsia, which can lead to few abnormalities, and the top of list is IUGR. Another term is very important to know, which is hypoxemic hypoxia. As we know, hypoxia is decreased availability of oxygen to the fetus, especially when we are talking about the IUGR. Reduced placental perfusion with maternal blood flow. So there is decreased or diminished placental perfusion with maternal blood flow, and consequent decrease in fetal arterial blood oxygen contents due to low PO2. IUGR, intrauterine growth restriction, describes the fetus who has failed to reach its own theoretical normal growth potential. It can be mainly of two types, symmetrical and asymmetrical, or we call it symmetric or asymmetric IUGR. In symmetric IUGR, growth rate decreases from early in pregnancy with a sustained low rate. So the rate of growth is decreased, resulting in growth rate which is decreased. These infants are usually small, presenting reduction of all their external measurements. As the name shows, it is symmetrical IUGR. So symmetrically, whole of the body is small as compared to the dates. So BPD, femur length, abdominal circumference are measured, and everything is smaller than the required size at that specific gestational age. In this case, growth decreases from early in pregnancy with a sustained low rate. These infants are usually small, presenting a reduction of all of their measurements. The symmetry has important prognostic implications as it relates to whatever primary process is limiting fetal growth and the potential functional damage that may follow. So there is something from the inside the patient, like if the fetus has got some infection, or any reason which makes the fetus sick